Thank you very much, Monsieur le Ministre, Mr. Minister, co-chairs, and esteemed colleagues. Thank you very much for giving me the opportunity to represent public service workers on this commission. PSI, Public Services International, welcomes the work of the Commission and its report, which is very timely since humanitarian crises around the world have exposed urgent public health concerns and the scarcity of health care workers. In particular, we appreciate the recognition of the fundamental role of health workers for the provision of quality health services and public health, and the strong focus on the need to foster quality education for health workers to ensure their fundamental rights, such as freedom of association, collective bargaining, safe working conditions and protection, as well as decent work and adequate wages. We commend the vision that addressing those issues will reduce discrimination of working women and youth and contribute to economic growth. We agree with the balanced recommendation the report delivers, its attention to socially sustainable solutions for the migration of health workers, and the need to regulate both private and public health services according to the same rules. We need stronger public governance, best practices, and models to be rolled out globally. However, we think the report should have been more explicit in warning against promoting investment models that have led to systemic deficiencies that negatively impact on access, quality, and equity of health services. Health is a fundamental human right beyond being an economic issue, and the government and governments have the ultimate responsibility and accountability for public health. This is why we firmly believe that the public sector plays a role that private actors cannot replace but can complement. The objective of SDG 3 will not be achieved without public investment. Reducing poverty is a matter of equity, justice, and social stability that requires public resources. Indeed, we cannot continue business as usual, but must recognize the need to restructure the international taxation system to capture immense revenues that are avoided and evaded. The implementation of global tax reforms could provide significant gains for government budgets, both in developed and developing world, needed to fund robust public health systems. The Ebola virus disease outbreak revealed the structural weaknesses of the health systems in Liberia, Guinea, and Sierra Leone, caused by decades of lack of investments, deplorable working conditions, lack of occupational health and safety for health workers, a refusal by the government to recognize the health workers' union and listen to their calls for help on the ground, all led to catastrophic results and global calamity. Collective bargaining and social dialogue can be important tools to improve working conditions and even save lives in such dramatic situations, as our experience shows in Nigeria and in the Democratic Republic of Congo. The report mentioned that health workers are the everyday heroes and cornerstone of resilient health systems. We do not claim that they are heroes, but workers who deserve dignity and the right to organize. Today, we hope that with the work that we have been developed, we could solve also the injustice that some of those heroes suffered being sacked after risking their lives fighting Ebola in Liberia, and we demand for their reinstatement. PSI will work with its affiliates around the world to disseminate the report of the Commission, build a strong coalition with other civil society organizations, and work with governments and all other actors towards the implementation of its recommendation and future action plan. In parallel, PSI will launch a global campaign for the recognition of health as a fundamental human right accessible to all in December 2016 as our contribution to Universal Coverage campaign. We remain concerned with the growing role of multinational and insurance companies in healthcare delivery. Identifying all global players and making them fully accountable could be another area of joint work for the future. Together, we can strengthen global governance and the regulatory framework that makes workplaces safer, our community safer, and ultimately provide the lives, improve the lives of workers and our community at large. Finally, I want to thank the experts for the excellent report that provide extremely valuable insights and will be useful tool for the follow-up of this process. Taking part in this work of this commission has been a positive experience for PSI, making sure that the voice of health workers is heard. And finally, I want to thank the government of France and South Africa for their leadership in such an important challenge. Thank you very much.
Next.